Sir Richard. Good morning.
Good morning.
I'm Miss Cherry, your health practitioner for today. I will be performing the head, eyes, ears, nose, mouth, and neck assessment. Starting with the head, first inspection is looking for your hair distribution, and then the shape and contour of your skull. And I'm going to be palpating, feeling any lumps, bumps, or any depression. Feeling your normal occiput back here. Okay. Moving down to your face, I'm going to inspect the symmetry, and then if there's any facial involuntary movements, and then if there is scarring or lesions, crushing of your eyebrows or eyelashes. And then at this point, I'm going to palpate, feeling your temporal pulse, feeling your temporal artery, going down to your temporal mandibular joint, and then going down to your TMJ. Go ahead and open and close for me. One more. Okay, good. Okay, next is assessing the patient in his visual acuity. Okay, so have the client stand 20 feet from the chart, and then now I'm using the Snellen's chart. So touch each eye separately, having him cover opposite eye being tested. Okay, sir? So can you cover your right side, and then read which line do you read?
Number 9.
Okay.
L E F O D F C T.
Okay. On the other side, doing the same.
Number 10.
Okay.
F D P L T C E O.
Okay, very good. Thank you. Okay, sir. Can we do again on the right side of your eye?
Okay. Number 9. L E F O D P C T.
Okay. Can you recognize the two colored bars in the chart?
Okay. It's color green and red.
Okay. Assessing the clients for his nerve vision. Have the client hold the magazine about 14 inches away and read. Can you read a little bit portion of the magazine, sir?
Creativity is finding connections between architecture and nature.
Okay. Thank you. Cover the patient's eye. I will cover your right side eye, sir. And then, can you focus the electric fan afar? And then I will uncover the eye and note any drifting. And note for the wick and presence of drifting of the eye. Same on the other side.
Yes.
Okay. inspecting for your eyebrows, your eyelashes, and then inspecting your internal structure of your eyes. It should inspecting the color. It should be nice and white. It shouldn't have any yellow color or jaundice. And then slightly lower your eyelids, looking for any color. It shouldn't have pale. It should have nice and pink in color. So I have here my pen light, and I'm going to look for your lens and pupil if there's any foreign bodies. And again, assessing for symmetry from to the other, looking for any differences in color and foreign bodies. Okay. So Sir Richard, I'm going to look your pupils, looking for pupils responses, making sure that your pupils are equally round and reactive to light. Shining light to your right eye, and the pupil must constrict. Shining the light to your left eye, and the pupil must constrict. Okay. Sir Richard, I will do the cardinal views of gaze with test your extraocular muscles and your extra ocular movement. Okay, just follow my pin light. Okay. Back to the middle. Okay, so follow my pin light, and as I bring it towards the bridge of your nose. Okay, good. Now I will palpate the the external structure of the eye, sir. Can you close your eyes, sir? Okay. Inspecting your sinuses, the frontal and maxillary, using my pen light. Note for the presence of periorbital edema and dark under Eve's circle. And note for the presence of red glow, light above the eyebrow and mucosal thickening. So, as I can see, there is none. Note for the size, shape, and symmetry. And then inspect the internal nasal mucosa. I will now tilt your head up. And with the use of pen light, I will inspect the nasal mucosa. Note for the color of the internal structure of nose, midline alignment of the septum, and presence of moist, intact skin. Now I'm going to palpate your sinuses, the frontal and maxillary. If there's any pressure or pain, is there any pain?
No.
Okay. I will now percuss the frontal sinuses and maxillary sinuses, feeling the tenderness or dull tone. I will palpate your ears. If there is any tenderness or there is any pain. Is there any pain?
No.
Okay. I will use my pen light for inspecting. Then I will put slightly. Note for the condition of the skin, presence of cerumen and color of the cerumen. And also note for the presence of foreign body. As well on this side. Now I will assess your hearing perception. Okay. Can you please cover your right side of your ear, and then I will whisper a word and tell me what is it. Okay. Apple.
Apple.
Same as the other side, please.
Banana.
Okay. Okay, the last part of the ear examination is using the tuning fork. Using the Weber test and Reen's test. In Weber's test, we will place the vibrating tuning fork in the forehead or the top of the patient's head. We should always note for the ability to hear equal vibrations in both ears. And the Reen's test, we will place the vibrating tuning fork on the mastoid process or the mastoid bone and count until the patient can no longer hear the tuning fork. And continue to note the length of time until the patient no longer hear the sound. Of course, we will immediately bring the vibrating tuning fork in front of the ear. Okay?
Yes. No.
Okay.
Yes. No. Yes. Yes. No. Yes.
Okay. Okay, well, this is actually the last test for the ear examination, which is the Romberg test, the inner ear vertebral function. So have the client stand with feet together, sir, and then eyes opened and then eyes closed. Then stand close by in case patient loses his balance. So in this case, you have to note the ability to maintain the balance of the client. So okay, Very good, sir. Thank you. Can you sit down? Then down to your patient's lips, we have to inspect the color, redness or lesions, or any herpes simplex. Then I'm using my pen light. I will inspect the mouth. Can you open your mouth, sir? Then inspect the teeth and bite. Okay. And have the patient open and close mouth. You have to note the occlusion or number or color condition of the teeth. Then open again, sir. Then inspect the color or condition or lesions or oral mucosa and gums, the tonsils, if there's any redness. Okay. So I put my glove on, sir, and then I'm going to feel some of the mucosa or any duration or masses. Can you open your mouth again, sir? Okay. You lift up your tongue, sir, and then I'm looking at the ducts where the submandibular and sublingual gland ducts are underneath her tongue, his tongue. Okay. Then stand in front of the client and palpate the cervical nodes. Lightly palpate the occipital nodes located at the back of the head. And then lightly palpate the post-auricular node located behind the ears. And then in front of the ears, which is the pre-auricular node. And lightly palpate the tonsillular nodes, the submandibular, and the submental node. Anterior cervical, posterior cervical node, lightly palpate the supraclavicular node located above the clavicle, and below the clavicle. Then I will now palpate the thyroid gland. Then, Sir Richard, can you swallow? Thank you. Okay. So assessing is if there is any lumps or bumps or any tenderness. Can you swallow, sir? Okay.